All right, everybody. Hello, friends, folks, and viewers. Jazz here at JazzOCRathLete, Urban Athlete Fitness, with the update on my surgery. So it's been 2 weeks now, and I'm off pain meds for a week, which is great because I didn't want to be on pain meds. And like I had mentioned in the last video, depends on the surgeon. When they're in there with their tools, how much are they with things around and manipulating and jarring things around, effing up the situation. That's really going to determine your healing time and how much time you're going to be on pain meds. So this guy was obviously really good. I do take it at night, so this video is really about a sleep hack I kind of came up with at night to make your sleep much more comfortable, if that's possible. So I'm going to go over that today. But at night is the only time I do take a pain med, an oxy, very light dose, 5 milligram. I don't like to be on them. I don't want to be on them. I think a lot of you agree. You want to be on those short amount of time as possible. And that's my case. So what I ended up coming up with, I tried different things, right? Because when you're sleeping in this sling, right, which you have to do, right, you're laying down, right, your arm is up here, right, so you're sort of elevated, right, your arm is up here, and my arm was going numb and painful every night throughout the whole night. So I couldn't even get a restful night's sleep, especially without the pain meds, because I tried both. And so I had to come up with a way, like, how do I make it where my arm is not so elevated? And so so at first I took this pad here, which is what this leans on, right? When this is on my body, it leans like that, so it's either your arm's at a 50-degree angle or a 30-degree angle, which is a little down here. So at first I had tried this, just put this around my body. All right, so when you are going to try just this, right, without the sling, kind of put it on here, your arm, kind of latch it, tighten it up. Right, now from here, right, you have some options because you get to slide this up and down the arm, and here, if it's down there, you're going to be able to sleep more like this, right? But once you put it up here, right, you can have a little more options what to do with the elbow, and this kind of really locks your shoulder in place. So you have options here, and then you can sleep here or here, right? Depends on how comfortable you are. So it's going to be a thing where you're going to try to find comfort with the pillow. Sometimes I'll put pillows behind me, so it keeps me kind of in place here. So let's sleep like this, like that, and put these pillows like right there, right, and put a pillow here. That's kind of how I'm going to sleep usually. My arms down here. And this is, I found to be the most comfortable so far. Now, my even less mobile my shoulder is because it's almost like a stray jacket. This is attached to your body, and my arm is down here, so it was not going numb at all. I was able to lay flatter, and it was much better. Right, but then it just started being like a little irritating because I was like, okay, I think maybe my arm needs to be in a different position, meaning a little more elbow flexion as opposed to straightening it out. So then I came up with a way to I kept the sling on. I'm going to show you that. I added a dish towel inside the cradle of this, so make it more comfortable. So I put a black dish towel in there. And here's a better look of like how I've lined my cradle with the dish towel. Just kind of folded it and put it there. Much more comfortable when you're sweating, and even at night, just to keep a little cushioning in there. Just make it a little easier for you. Kind of keeps it a little more snug as well. So once I got this on, that might have been loud on the mic. So once I got that on, I put this on the outside of my body. Okay, the outside of my arm. I don't know if you're going to hear this a little louder on the mic. Okay, so basically I'm set up where I'm still in the sling, and this is still holding my shoulder in place, and still allows me to be able to sleep kind of flattish. I'm still a little elevated, but I'm flattish here. And you know, my arm, if I flinch or something like that, move too quick, my arm is in a pretty stable position. You could tighten this up, obviously, as much as you need to. Sometimes once I lay down, I realize it's a little loose, and I'll tighten it up. This is what I've been finding like the most comfortable position to be in. Instead of this being underneath me and lifting my arm up and my arm going numb, now I'm able to kind of sleep with my arm close to my body. I'm much more comfortable. Still, I'll take the Oxy because nighttime is just miserable overall. But other than that, I find that this could be a good idea for you to try again with this, or the other way without the sling, and just put this on the outside of your arm, kind of lock it in. They both kind of worked good for me. All right, so moving on, we're going to show you how to put on a shirt. All right, this is going to be a tough one. As you can see, I can move my arm around, right? Just, I'm not supposed to be doing too many things unsupported, but you know, I'm not completely immobile. I just can't really put any kind of weight or stress on my hand, activate this bicep. All right, as far as getting dressed, right? So I could kind of lift my arm a little bit, but even if you can't, right, you have to keep it here. That's fine too. You just put your arm, slide your arm in like that, or in this case, I can get both arms in here like this, right? But right away, I'm putting my arm down. I'm gonna slide it up my shoulder, put my head in, and there. So that's how I've been getting dressed. I've been wearing looser shirts, obviously, the normal, but I'm also losing weight. So every shirt seems to be kind of loose right now. I dropped 3 pounds, which is, you know, partly because muscle mass, and partly because a little more sedentary than I'm used to. So my appetite's kind of reduced, so I'm not eating as much. I know some of you might go the other way and just be sedentary and eat a lot, and start gaining weight during this time, but I'm losing weight during this time. So be careful about the gaining weight part during an injury. Taking your shirt off, kind of the same deal. I kind of help a little bit here, but overall I just use this arm. Just a little help there from the hand, but other than that, I just slide there. So that should be the quickest, easiest way to not need help putting a shirt on. I know men out there who don't want to feel like we're helpless and hopeless, so we just want to do as much for ourselves as we can. So that's one thing you might want to do: put on your own shirts, right? Give you a sense of accomplishment for the day. All right, so that about wraps that up. I sought physical therapy. I started last week. I'm going to continue it this week. I'm going to put a video up of what I'm doing with that, and then we're going to take it from there. So hopefully you can learn something from this sleep hack if you're dealing with shoulder surgery and being in a sling, and how to put on a shirt. All right, thanks again for tuning in. JazzOCRathLete, Urban Athlete Fitness. Let's go. Peace.